In longitudinal studies, we got much closer to establishing causation between exposures and diseases, since we were able to follow participants over time and see which diseases they developed after being exposed to which exposures. It is a much more rigorous method than, say, case control studies because it limits sampling and reporting bias. However, even longitudinal studies cannot say for sure whether X caused Y. The only way to truly establish causation is through experimental studies, which we will talk about now. The experimental study is possibly the most powerful research approach. It is the only type of study that can determine causation. However, it is also one of the most involved approaches that requires a lot of careful decision making during its design and execution, with particular attention to ethical issues. An experimental study assigns participants to intervention and control groups in order to examine whether an intervention causes an intended outcome. Accordingly, the primary question is, does the exposure cause the outcome? For example, we might ask, does eating gluten increase depression symptoms in people with celiac disease? Or we may ask, does a social work intervention decrease hospital readmission? This approach is used whenever possible. That is, when ethics and resources allow us to induce an exposure in order to assess its outcome. It is used not only to assess whether a bad exposure has harmful outcome, but also assesses whether an intervention, such as treatment, medication, or preventative measure, has the intended helpful outcome. Designing an experimental study can seem daunting. Here are 4 major steps to get you started. 1. You should decide on the outcome, that is, the dependent variable. Second, you should decide on the intervention and control conditions, that is, the independent variable. Then you must decide on the sample using inclusion and exclusion criteria. And lastly, you should decide on whether and how to perform randomization and blinding. Now let's look at each of these steps separately. First, deciding on the outcome of interest, the dependent variable. Sometimes it's easy to forget that we conduct experimental studies because we care about specific outcomes. We can get caught up in designing an airtight experiment and lose sight of the ultimate goal of the study, to test the hypothesis that an intervention or exposure causes an outcome. That's why we should start here first. For example, let's say you hypothesize that follow-up phone calls from a nurse in the first 3 months of a baby's life will reduce major health problems for the baby. The outcome here is the amount of major health problems. How will we measure it? Perhaps by the rate of hospital admissions, perhaps by the parents' responses to a survey, or the rate of health problems noted in the baby's medical charts. This will end up being your dependent variable. Next, we will decide on the intervention or exposure, which will be your independent variable. The intervention is at the heart of the experimental study in health research. Usually, interventions are meant to improve quality of life and ameliorate disease. Though some experimental studies, usually performed on animals, introduce potentially harmful exposures instead of interventions to see what effects these exposures have. For our purposes here, we will focus on intervention studies because they tend to have more direct practical consequences for healthcare practice. Before beginning an experimental study, researchers must clearly describe 1. What the intervention will be, 2. How and where participants will receive the intervention, 3. When and how often and for what duration participants will receive the intervention, and lastly, any potential benefits and risks of the intervention. The last step is extremely important. Experimental studies are particularly prone to ethical problems, since researchers are not merely passively observing, but rather actively affecting participants. Researchers therefore have the responsibility to make sure that the benefits of the intervention outweigh the risks and burdens, and that no risks are too high. For example, perhaps a new drug might manage a kidney disease, but the risk would be too high if there's also a good chance that the drug will cause major brain damage. From our example before, we may decide that the intervention is weekly nurse phone calls to a newborn's parents within the baby's first 3 months of life. An important part of this step is to decide on the control condition, because now we have an intervention to test, but how will we know that in the end it was the intervention and not some other factor that causes the outcome? What if it wasn't the nurse phone calls that help baby's health, but merely the fact that families who do things like sign up for health studies are more likely to already have better health knowledge for taking care of their baby? Or maybe it was just their expectation to have a better outcome that resulted in the better outcome. In other words, how do we guard against the placebo effect? To ensure that the intervention is the only variable causing the outcome, we use a control condition. This is the condition without the intervention's active ingredient. If the active intervention leads to improvement and the control condition doesn't, then we know the effect is likely to be real. But if both conditions lead to improvement, then we would have to do further research to see if there was maybe a placebo effect. Some common types of control conditions are placebo, waitlist, or treatment as usual or standard care. Now let's look at each of them in turn. The placebo is an inactive comparison that is similar to the therapy being tested, such as a sugar pill that looks like the active medication, a saline injection instead of a drug injection, or a sham procedure that is designed to look and feel like a real procedure. If this option is feasible, it is the most powerful type of control condition because participants cannot tell if they are in the intervention group or the control group, and therefore the intervention's advantage, if there are any, over the placebo could only be due to the active ingredient and not due to the mere expectancy of improvement. However, for some interventions, such as behavioral therapy, it's not possible to design a totally believable placebo where participants think they're getting the intervention but are not. In this case, you can use an active comparison condition, an intervention that is an intervention but is different from the intervention you're most interested in testing. For example, an active comparison condition for the nurse phone call study might be a one-time 15-minute nurse education session. This active comparison is an intervention, and it still allows researchers to test whether ongoing phone calls from a nurse is effective compared to no ongoing phone calls. This type of active comparison is often the most ethical approach because this allows every participant to get at least something out of participating in the study. The waitlist control is an inactive comparison in which participants simply do not receive the intervention, but are put on a waitlist until the end of the active study period. This option is often used for non-drug therapies such as psychological interventions, when it's really hard to design a placebo that feels and looks like the real intervention. The participants who are on the waitlist are monitored over the same period as those who are in the active intervention group. The reasons for using the waitlist, instead of simply monitoring a group of participants who are not getting the intervention, are both ethical and practical. One, we would not want to deny any treatment to participants who are hoping to benefit from it, and two, participants on the waitlist still have the expectancy of receiving treatment in the future, which is the closest we can get to the placebo effect. Lastly, we'll look at the treatment as usual or standard of care control condition. Sometimes it's unethical to use a placebo. For example, when an effective therapy is already available and the current study is testing a new therapy to see if it's at least as good or even better, then it is appropriate to compare the new therapy to the best existing therapy, called standard care, or the therapy that the patient is already receiving, called treatment as usual. This allows us to hold our new therapy up to a very rigorous standard. The next step when designing an experimental study is deciding on the characteristics for your sample, that is, putting together an inclusion and exclusion criteria list. So researchers carefully consider whom to include in their studies, and then they make this list to ensure that they recruit participants representing the target population. For example, you may want to have an age cutoff if your research question concerns toddlers. When you decide on the cutoff, make sure you're basing it on something valid. Instead of just sort of choosing 3 years of age because you feel like that's a good cutoff, consult existing literature to see what other researchers use as a cutoff for the toddler age group. They also use inclusion and exclusion criteria to protect participants' safety. For example, some elderly people with walking difficulties should probably be excluded from a Zumba exercise intervention to prevent the possibility of injury. These criteria also ensure that participants do not introduce any confounding variables. For example, if you want to test an exercise program to combat obesity, you may want to include people who are currently obese and exclude people who are already major athletes. After all, there's not much room for the athletes to improve. Also, you can use exclusion criteria to make sure that your participants are not also undergoing other treatments for obesity or have some other characteristic that might affect how your exercise program works. We want to be able to attribute any weight loss to the intervention being tested, not another unrelated factor, like, say, enthusiasm for Zumba. Next, we'll talk about randomization and blinding. Randomization refers to the process of randomly assigning participants to either the intervention or the control group. The reason for randomization is to minimize researcher or participant bias. For example, if you created what you believe is the best new therapy for hypertension and you cannot wait to prove this, you may be biased to assign the most enthusiastic participants to the intervention group and the participants that are least hopeful to the control group. Not only is this unethical, whether or not you do it on purpose, this also biases the outcome. The most common type of randomization is simple randomization, which is essentially using a coin toss to determine group assignment for each participant. There are other types of randomization that take demographics and clusters into consideration, but those are for very complex study designs, and we won't worry about them here. Now, blinding, also known as masking, occurs when participants and/or researchers do not know whether a participant is in the active intervention group or the control group. The reason for blinding is also to minimize bias. For example, blinding prevents participants in the active condition from reporting more favorable results because they expect a positive outcome or because they want to say nice things to you, the researcher. It also prevents you, the enthusiastic researcher, from intentionally or unintentionally recording more favorable results for the intervention you created. In a single-blind study, either participants or researchers are blinded. And in a double-blind study, both participants and researchers are blinded. And there you go. Those are the easy, or maybe not so easy, steps to designing an experimental study in health science. To recap and summarize, the most important first steps to take are 1. Deciding on the outcome, your dependent variable. 2. Deciding on the intervention and control conditions, which is your independent variable. Deciding on the sample, so figuring out an inclusion and exclusion criteria list. And lastly, deciding on whether and how to perform randomization and blinding. To see an excellent example of an experimental study, read the article by Bronstein and colleagues. Your understanding will be assessed.